Nicola Sturgeon warning that dropping this stay-at-home message could be a catastrophe if done too early. Do you broadly agree with that?
But this is my point. It's addressed to both Boris Johnson and it's addressed to Nicola Sturgeon. Whatever you do in the future is dependent on whether you have got some protection for people, and that means you've got a test. And my complaint is, in Scotland, as in the UK, only 1.5% of the population have been tested for this virus, that it's difficult to end the lockdown, but it's also difficult to give people reassurance, and it's going to be difficult to get the rate of infection down unless you can assure yourself that people have been tested and are not carrying the virus. And both the Scottish Government and the UK Government are failing to do this. And it's become so obvious to me, because I haven't wanted to speak out in criticism. I've wanted always to be constructive. But if you have old people's homes, as we have in Scotland, and half the deaths are coming out of old people's homes, and in half the old people's homes and more, there are people with this disease, if you don't test people until after you've got a case, then you are simply trying to solve a problem after it has been created. You've got to have proactive testing. It's got to be preventative testing. It's got to be regular and routine. And to be fair to every care worker and to be every resident, to be fair to them, and also to be fair to people in the health service, we should have routine testing. And before Boris Johnson makes more announcements and before Nicola Sturgeon does anything else, she should address, and he should address, the failure to test enough people so that we cannot be sure who has the disease, and we cannot be sure because symptoms are being carried that are not obvious to people, and people are infecting people without us knowing it.
Right. So, and just to be clear, you're saying not enough testing yet for Boris Johnson to ease the lockdown at all, even slightly?
I think both of them have got to address this problem, that you cannot reassure the public. You're asking people at some point to go out and make contact with other people, but you're also trying to get the rate of infection down. If you're not testing sufficiently, and remember the chief medical officer, the chief scientific officer admitted that not enough testing had been done at the beginning. As I say, I haven't wanted to come in on this, but when I see that only 1.5% of the British population have been tested, that even at the best, Boris Johnson's 200,000 figure a day would be testing only 0.3% of the population. In Scotland, the figure is actually less ambitious than Boris Johnson's new figure. It's just not good enough. The only way, when you don't have a vaccination, if there was a vaccination, you'd tell everybody to get vaccinated. In the absence of a vaccination, you've got to test, and you've got to find out who is carrying this disease and how you can isolate them quickly from the rest of the public. But of course, if people are staying at home and don't have the disease, then you can actually test them and they could get back to work.
Right. But I mean, if you believe the papers here, like headlines like Happy Monday, and you know, a sense that there is going to be a slight easing even from Monday of the lockdown. You think that could be a reckless way to start things, do you?
But Mark, you're getting obsessed about a story that has not even been announced yet. It's all speculation. I don't think Boris Johnson can make an announcement on Sunday in the way that these papers are saying so, without ramping up testing massively. So let's concentrate on the problem rather than on headlines that actually mean very little until we see the results. And everybody's reacting to stories that are speculation. What you've got to do is deal with the real problem. People are dying in old people's homes and people are dying elsewhere. And one of the reasons they're dying is the failure to test. It's both wrong and it's tragic. And I feel sorry for health workers who are being dragged into situations where they are trying to do their best to save lives and putting their lives at risk because we haven't tested them. I talked to one of the heads of an old people's home in Scotland today, who runs actually 15 homes, and he told me that he had 1,100 staff, and he'd only been able to get 162 tested. He had 700 patients, and only 192 had been tested. And this in a situation where everybody is saying that care homes are the epicenter of the crisis. He told me about people who were carrying symptoms, and he had not been able to get them tested. Now, this is something that could be dealt with today and tomorrow. Right. And the report that we put out today from our Scottish Future says what can be done. What you do is you ramp up your manufacturing capacity, just as if it was a wartime effort. You ramp up your manufacturing country, refigure companies if necessary to produce the testing equipment. Then what you do is, of course, you have centres all over the country, far more than we've got at the moment. Mobile testing, home testing, workplace testing, you get it done. And then the next thing to do is you get the laboratory capacity properly used. And of course, there are spaces that are not being used at the moment that could actually be brought into use. Now, if you had a wartime mobilization strategy that was dealing with this, then you could ramp up the number of tests by hundreds of thousands every day. And that, in my view, in the absence of a vaccination, is going to become essential. And anybody who wants to talk about the next few days has got to talk and explain why, if they're going to make changes, or if they're not going to make changes in Nicola Sturgeon's case, they have failed on testing and they continue to fail on that front.
OK, now look, you're a former Chancellor. You know better than I do that business is going to be crying out to get back to work, particularly the Bank of England's warning about the sharpest recession on record. There is this argument that we just simply need to get businesses back operating.
Look, the economy exists for people. People don't exist for the economy. We know that you cannot solve this economic emergency unless you start to solve the medical emergency. We know that unless you can actually get people properly protected against this virus, you cannot get everybody in the way that you want back to work. So let's deal with the health emergency. Let's get it sorted. Why is it, after 3 months, that 98.5% of the population have not been tested? If this was a vaccination, you would be demanding 100% vaccination coverage by now. Why, when in the absence of a vaccination, we're relying on testing to know how we can avoid people being in contact with the disease? We don't have the testing, then the contact tracing, then the isolation. Of course, we need the hand washing, and of course, we also need the social distancing. But there's a missing element in this that you can't solve the economic problem unless you've got some progress on the health problem that is good enough to be able to give people confidence that they can come into contact with other people.
But isn't the point here that the casualties of a prolonged shutdown could be every bit as bad as the casualties from the virus in the circumstances we're in?
Well, are you wanting to put lives second to livelihoods? You cannot do that, Mark. You've got to deal with the health emergency. And really, I've had to enter this debate because people are talking in abstract terms about the next few weeks, and there's all these headlines today. But the reality is, when you look at the figures about what's actually happening on the ground, we are leaving people far too vulnerable, and we've got to do something about it. Now, I've got plenty of ideas about how we can bring the economy back. And I know from my own experience in 2008 and 9, you will have to do it without causing the levels of unemployment that people are predicting, the levels of bankruptcies that are inevitable if we do what is being proposed at the moment, the levels of mortgage repossessions that we saw in the 80s and the 90s, but we avoided in 2009-10. Now, there's plenty of ways that we can plan to do this and do it purposefully, but you cannot do it successfully unless you've dealt with the medical problem.
Yeah, but do you agree that the way Rishi Sunak is handling this is broadly right, that they are throwing money at it?
Well, I was the one who said, look, in his first set of proposals, he had missed out employment. And then, of course, he did the right thing and he guaranteed that people's employment would be safeguarded. But that's only stage 1 of the crisis. Look, stage 2 is dealing with what happens when the employment subsidy is starting to either run out or it's removed altogether. And when the banks are calling in the loans that have been given, because it's only loans in the main, there are some grants, but mainly loans that have been given to companies. Now, we've got to deal with a situation where unless there is a second phase of government action, unless they are coordinated in the way they approach the recovery, then large numbers of businesses that may be viable over the next year but can't create sufficient revenues over the next 3 months will be brought down either by the banks or by the Inland Revenue or by the VAT authorities unless we're able to do something to help them. So yes, we need an economic plan. The easy part, in a sense, economically has been done. You hand out money, you say to people, we can reassure you for the next 3 months. But the difficult part, as the Bank of England would, I think, emphasize, is you've got to have a plan to keep unemployment low. You've got to have a plan to stop business bankruptcies. And I think I know that there are ways that we can do this. But first of all, you have got to sort out the medical emergency.
Yeah, just a couple more. I mean, broadly speaking, obviously it's a crisis of huge challenges for any government. What do you make broadly of the way this is being handled, given the trajectory that we're on?
Well, I want the government to succeed in this, and the whole country wants the government to succeed. I want the UK government and the Scottish government to succeed. That's why I want to be constructive and not critical. And I obviously want to look forward with proposals that I'm making today and not look back. But unless the government listens to the proposals that we are making about testing, and unless they match that to the contract tracing and to the isolation policies and put that complementary to social distancing and the way they move that forward, we will still have both the medical and the economic problems some months from now. I want to avoid a second wave and a second peak, but the way to avoid it as you're trying to come out of your first peak is in my view, and I come back to it because we have looked at studies that have been done in America and elsewhere, studies that have been done in Europe, and we have been, let's be honest, we have been testing about half the population as a percentage. That the countries that have been more successful, Germany, Norway, Denmark, Korea, we've been half as successful as doing that testing as these other countries. And we've got to learn some of the lessons from what has been more successful than what has happened in this country. So I don't want to be critical, but I want to put forward constructive proposals about what can be done. And I don't think anybody should be in any doubt today that you cannot avoid a second peak unless you do more about testing.
Okay, and just finally, you made great play early on in this crisis of global cooperation. Isn't the truth that it's basically every country for itself and there's precious little global cooperation?
Well, if we're going to get out of this and eradicate this disease in entirety, we're going to need global cooperation, because unless the vaccine is in every country, it's not going to make us altogether safe. And unless we build up capacity to deal with these problems in the poorest countries, they're going to come back to haunt us in the richest countries. I've been disappointed by the level of global cooperation. There was a pledging conference, and I was pleased that Boris Johnson was part of that on Monday to raise money for the vaccine and to build up the capacity in our healthcare system globally. But certainly more has got to be done, and we must not retreat into this America first, China first, India first, Russia first, the sort of approaches that have been taken for too long. The evidence is that if one area merits multilateral cooperation and has got to, can only work with multilateral cooperation, it's dealing with a pandemic.